In this week's Healthy Living, we're discussing attention deficit hyperactivity disorder and talking about how treatment methods have improved. We'll also tell you about 2 ADHD meetings you can attend if you'd like more information. Dr. Chalab with Springhill Medical Center explains. We're here to talk about ADHD this morning. For those who don't know, just kind of give a brief general description of what it is.
Sure. ADHD is problems in paying attention and with also hyperactivity and difficulty focusing and impulsivity. And we've been dealing this with for many years. But most recently, we've come into a better understanding of what causes it, which has led us to figure out how to treat it more effectively.
On that note, what has been the biggest advancement in the understanding of ADHD?
Sure. Let me use these things to show you. The biggest understanding that we've come to has been in which parts of the brain are involved. And it's basically the frontal part of the brain, where you can see here is called the frontal cortex. And there's the top, the middle, and the bottom, where they go by big names, inferior and ventromedial. But this is just another shot right here of how it looks from the side.
Okay.
And we know that the top part controls attention, the middle part controls impulsivity, and the bottom part controls emotion. So if you take a little piece of brain out of that frontal cortex that we take right here, and we blow it up, and this is a nerve cell taken from the piece of brain going from one cell to the next. And basically the concept is that chemicals are released from these nerve terminals that go to these nerve terminals that close these channels, which allow you to process information. In children with this problem, they cannot do that. What the medicine does for the effective treatment is make more of this, which goes here, closes these channels, and then allows the child to transmit information.
You mentioned medicine. Is that the most effective treatment?
It is. Over the years, many things have been tried. But that's not the only way we approach it. But in terms of the most effective way, it is medication treatment, which is now safe, it's reliable, and lasts the entire day.
In terms of the treatment, you wanted to talk about the testing and treatment. There's some misconceptions associated with ADHD. Can you talk about some of those?
Sure. The treatment is basically a comprehensive approach where we use not only medication, but we use educational testing, and then we use counseling. So it's oftentimes necessary to do all of that. What we have found is that in certain places that tests that are not valid, that are expensive, are being used, such as computer tests, the TOVA, the quotient, and I would advise people to stay away from those because you really don't need to do it. You need good educational testing to tell you what the problem is.
And on this topic, like you said, information is power. Speaking of which, you have a couple of conferences coming up. Can you tell us about those? Sure.
We're in September the 13th and 20th at Springhill Hospital in the evening. We have one conference that deals with adults on September the 13th, and then on September the 20th, this will deal with children. We're going to cover the entire concept. We'll take questions and answers be given, hopefully that will help people deal with this problem. It is a devastating problem because it deals with about 5 to 10% of school-age children.
Wow. And on that note, if you have any more questions or concerns, you can also find out more information on our website. Just click on the Studio 10 tab and you can get in contact with Dr. Chalab. Thank you so much for joining us on the show this morning. We appreciate it.